Respected teachers, I am Dr. Abhijeet Singh, second year junior resident from Jawaharlal Nehru Medical College, AMU Aligarh. My topic for oral paper presentation is role of coronary CT angiography in suspected CAD patients using coronary CT angiography based Lehman score and its further correlation with invasive coronary angiography based syntax score. Now the background of this topic is coronary artery disease accounts for 16% of the world's total death and is the leading cause of mortality worldwide. The workup of patients with CAD is complex, with patient often requiring invasive procedures. Early detection and timely management is the key to achieve the longer survival. Now CT coronary angiography involves the following step. First is the patient preparation and pre-medication. Involves the fasting for 4 hours. Patient is asked to hold caffeine intake, metformin, and if it is taking sildenafil 12 hours prior to scan, and continue all cardiac medications as usual. If heart rate is more than 65 beats per minute, then oral 50 to 100 mg metoprolol is given. If heart rate is still more than 60 to 65 beats per minute, then oral ivabradine 5 to 10 mg is given. IV metoprolol nearly 5 mg, maximum 15 mg can be given immediately before the contrast. Acquisition techniques involve either prospective or retrospective gating. Multiplanar reconstruction include curved MPR, MIP images and BRT images. Now the aim of my study is to stratify the patients based on risk of major adverse cardiac events correlate with the invasive coronary angiography. Inclusion criteria includes patients of all age and sex with suspected coronary artery disease based on clinical history and or on non-invasive testing, prompting a clinical referral for coronary angiography. Patients with known allergy to iodinated contrast media, elevated serum creatinine more than 2 mg per dl, atrial fibrillation, uncontrolled tachyarrhythmia or advanced atrioventricular block, second or third degree heart block, severe symptomatic heart failure, NYHA class 3 or 4, suspected acute coronary syndrome, diagnostic ECG, and pregnant women are excluded from my study. Now briefly talking about the review of literature. Coronary CT angiography evaluation for clinical outcomes, international multi-center confirms study showed CT Lehman score to be an independent predictor of major adverse cardiac events. A prospective study including 1304 patients done in Italy concluded with risk stratification of patients undergoing CCTA into low and high risk groups on basis of major adverse cardiac events as follows. Group 1 Lehman score is less than 5, Group 2 Lehman score more than 5. Acute catheterization and urgent intervention triage strategy equity trial run at 450 academic and community based institutions in 17 countries divided patients undergoing invasive coronary angiography into low and high risk groups on the basis of cardiac events as follows. Group 1 is syntax score less than 8, Group 2 is syntax score more than 8. Now methodology. Patients satisfying inclusions and exclusion criteria were included in the study. Prospective type of the study. Scan performed on 128 slice GE revolution EVO. Scan reformation and reporting done on GE AWS. Patients having significant lesions, more than 50% reduction in the luminal narrowing is seen. Total 222 patients were included in my study, out of which 158 patients had no obvious plaque and a Lehman score of 0.64 patients had plaque and were further divided into low and high risk groups on basis of CT coronary angiography based Lehman score. 37 patients had Lehman score of less than 5 and were put in low risk group. 27 patients had Lehman score of more than 5 and were classified as high risk patients. Out of 64 patients that had plaques on coronary CT angiography, 37 patients were put in low risk group. None of the patients underwent invasive coronary angiography. Out of 27 patients put in high group, 15 underwent invasive coronary angiography and all 15 patients were classified as high risk based on invasive coronary angiography using syntax score. Curved MPR CT coronary angiography image from one of the patient of a study shows a short segment mixed density plaque involving the proximal LAD, causing 70 to 80% luminal narrowing, and the invasive coronary angiography of the same patient showed 80% stenosis involving the proximal LAD. A European Society of Cardiology for cardiac thoracic surgery shows that out of 222 patients, 158 had no obvious findings with CT Lehman score of 0. 37 patients had Lehman score less than 5 and rest 27% had Lehman score more than 5. Out of the 27 patients put in high risk group, 15 underwent invasive coronary angiography. All 15 patients was also classified in high risk group on invasive coronary angiography based syntax score. 5 to 15 of patients have a syntax score more than 22, thereby having CABG as preferred modality of revascularization according to ECS and EACTS guidelines. 10 out of 15 of patients have a syntax score less than 22, therefore could not undergo PCI owing to the reduced state of procedure related complication. So to conclude, no obvious findings seen in 71% patients, only 29% patients had stenosis or plaque and were further stratified into low risk and high risk. Patients put into high risk category on CCTA, ICA also stratified them into high risk group, thereby showing positive correlation with CT angiography findings. All high risk patients were successfully treated with either PCI or CABG, with the treatment modality being chosen being based on syntax score. CT coronary angiography has emerged as a non-invasive alternative to invasive coronary angiography for the diagnosis of coronary artery disease. It further helps in stratification of patients based on risk and refines the patient procedure to patient requiring treatment for ischemic coronary disease and improving the comfort of patient. These are the various references. Thank you.